Good afternoon, and I want to start by thanking Public Health Commissioner Monica Burrell and Secretary of Health and Human Services Mary Lou Sutters, and I especially want to thank the people standing behind me here for the work that's been done in partnership with the 3 dental schools here in the Commonwealth. Today we are pleased to announce, along with the Mass Dental Society, the first in the nation set of dental education core competencies for the prevention and management of prescription drug misuse. This set of core competencies will ensure that the Commonwealth's more than 1,800 enrolled undergraduate dental students and 550 advanced graduate dental students receive enhanced training in primary, secondary, and tertiary strategy for the prevention and management of prescription drug misuse. This is our second announcement on core competencies with the Commonwealth's medical schools. Last November, you may recall that we unveiled a similar agreement between Boston University School of Medicine, Harvard Medical School, Tufts School of Medicine, and the University of Massachusetts Medical School and the Massachusetts Medical Society. These educational standards represent an innovative and forward-thinking contribution to the state's multifaceted strategy to curb the opioid epidemic. I'm proud that our state is once again setting a new standard by providing our medical students with a strong foundation in education with respect to pain management. With nearly 4 people dying a day here in the Commonwealth, our administration is focused on bending the trend to combat this horrible epidemic from one community to the next. And that's not only as your governor, but as a parent, I'm committed to using every tool in the toolbox to reduce opioid abuse. This is a significant step forward, but we know there's a long road ahead and much more work to be done. Since taking office, we've made significant budget investments, enacted numerous reforms from the governor's opioid working group, and I've signed 3 pieces of legislation, including most recently the legislation ending the practice of sending civilly committed women to Framingham State Prison. To date, 21 of the initiatives that were recommended by the governor's task force have been fully implemented. 24 initiatives are currently being implemented. In both of our budgets, we invested over $250 million toward the opioid epidemic, $114 million in fiscal 16 for substance abuse, $140 million in this year's budget for education, prevention, and treatment, and an additional $28 million approved in the supplemental budget last fall, which was mostly tied to prevention, education, and treatment initiatives as well. We've also added additional treatment capacity, 69 acute treatment service beds, 23 clinical stabilization service beds, 81 adult residential recovery home beds, as well as 5 office-based opioid treatment programs. We implemented a bulk purchasing program which permits first responder agencies the ability to purchase Narcan for $20 per dose, and in conjunction with the state's medical schools, including this one here today, we created 2 sets of core competencies for education on opioids for medical students. We're also going through a complete overhaul of the prescription monitoring program to make it easier for practitioners and prescribers to use the program and to connect it with surrounding states. This should be available for use June.
That's what I said.
Sometime this summer. I'm hoping it's before anybody gets any sun. We also opened the 5th new recovery high school in Worcester and created and launched 2 major media awareness campaigns, one around addiction and the other around stigma. And the legislation we filed last fall has been heard by the Mental Health and Substance Abuse Committee and currently sits along with legislation that was passed by the House and the Senate to deal with this issue in a conference committee. I think it's very important, critically important, for those 2 conference committees, for that conference committee, to get its work done and to get a bill to my desk that we can sign so we can continue to pursue our strategies to combat and ultimately wrestle to the ground this opioid epidemic here in the Commonwealth.
The governor has said we have engaged in a multi-phase, multi-year strategy, public health strategy, to bend the trend of opioid deaths in the Commonwealth of Massachusetts. Prevention, intervention, treatment, and recovery. And standing today with the dental schools and the Massachusetts Dental Society is extraordinarily important. As people know, because you've heard this statistic before, in calendar year 2014, in the Commonwealth of Massachusetts, there were 4.4 million prescriptions written for Massachusetts residents, yielding 240 million opioids. The numbers are actually higher when you include the prescriptions written for people who come to Massachusetts for their care. But this is so, it's 4.4 million prescriptions, 240 million opioids for Commonwealth residents in one calendar year. Working with the dental schools and the Dental Society is so important, as it is very important for not only the 2,300 undergraduate and graduate students, but also to sort of teach up to, as we were discussing a little while ago in the governor's office, for those dentists that perhaps have gotten into a habit of their prescribing practices. So standing together marks another chapter in the Commonwealth's efforts to deal with the opioid crisis. The announcement follows the similar agreement among the Commonwealth's 4 medical schools. All 3 schools have agreed to establish the appropriate curricula to ensure that these core competencies are being taught and students are being tested on the materials. It is a great example of Massachusetts paving the way, and I know that these deans will be speaking to the deans across the country, as well as publishing within their journals a way to increase the competence of all of the dentists, not just in Massachusetts, although the governor would like everyone to stay in Massachusetts, but for those dentists who leave here and go to other states, again, sort of extending what they've learned here to try to deal with the opioid epidemic in the Commonwealth and across our nation.
Dental students, medical students, and other prescribers are in their most formative years when they're in school. It's during these professional school years where often lifelong habits of practice are developed. Therefore, it's so important that the dental schools have come together today to adopt these core competencies. The competencies are based on using evidence-based methodology to screen individuals for pain, substance use disorder diseases, as well as having an understanding of how to appropriately refer and to work across different disciplines. As we look at substance use disorder as a chronic medical disease, this is such a critical step for us. The governor's opioid working group listed prescriber education as a critical piece of our path towards bending this opioid crisis death curve. This is a critical step that we've taken today, and I applaud the dental schools for adopting these core competencies uniformly across the state, first in the nation. Thank you.
My name is David Keith. I'm an oral maxillofacial surgery surgeon at the Massachusetts General Hospital. I'm on the faculty of the Harvard School of Dental Medicine. I've been involved in orofacial pain issues for many, many years with my colleagues in those institutions. As the governor has said on many occasions, prescription opioid crisis affects us all. It ruins lives, it devastates families, and has a significant impact on our communities. The fact is that over 80% of those prescriptions which are diverted or misused comes from prescriptions written by our physicians and dentists. And this is a unique opportunity that the governor has given us for the 3 dental schools and for the Massachusetts Dental Society, which represents the vast majority of the practicing dentists in this state, to come together to educate our dentists and advanced dental trainees in the correct prescribing of opioids. Not only in that, but to help them to understand the diverse nature of pain in the mouth and face, to give them the skills to choose between opioids, non-opioid alternatives, and perhaps non-medications alternatives to deal with pain, to mention and discuss with patients and families the risks, benefits, and alternatives of opioids, and to discuss these issues as necessary with our colleagues in the medical nursing fields and the pharmacy as well. So the dental community thanks the Governor, the Secretary, and the Commissioner for this opportunity for us to be part of the solution to this very large problem.
Delighted to be here. I had the opportunity to work with I'm Ron Kulich. I'm at Tufts School of Dental Medicine, and I actually happen to be a psychologist, so I'm an outlier here, as I said earlier. But I've been working for many, many years with David and the schools to address some of these issues, and I think this is really a new beginning because there's opportunity that I've seen not happening in the past. And it's not just the issue of educating young dentists. A major focus is this whole issue of cross-communication between dentists and physicians and other stakeholders for patients who may be very challenging in many cases. And this gives us an opportunity to provide really perfect care for those patients.
Let me just elaborate a bit on one of the points that was made, which is that, and this was not something I thought about before, we're going to try and get these guys together with some of the ER docs, because one of the things that happens many times in an ER is somebody shows up with pain in their jaw, pain in their mouth, pain in their teeth. They don't end up seeing a dentist or getting referred to one. They simply get a prescription to deal with their pain. I would love to figure out some way to connect these folks and many of their colleagues here in Massachusetts so that they can engage with the emergency room docs on alternatives to writing that prescription for folks who show up who have symptoms and signs that are associated with pain in and around this area. The other thing I want to mention is we talked a little bit about the fact that they have continuing medical education requirements. And within those continuing medical education requirements, they're required to take a couple hours of courses associated with pain management. But those pain management courses that they're expected to take very rarely have to do with dental issues per se. They might deal with orthopod issues or oncology issues or other sorts of issues, and that doesn't make them irrelevant, but it doesn't make them specific and focused as they probably should be on pain that's related to the type of pain that's typically associated with oral surgery and the practice of dental medicine. And I think the opportunity across all the boards of registration associated with the curriculum development and the rules of the game associated with in-service education could benefit a lot from getting a lot more targeted and focused on the particular areas where we think we have a real opportunity to move the needle. So with that said, again, I want to thank you all very much for your help and participation. The final thing I say is Secretary Sutter said when they had their first meeting with the folks from the dental school and the dental society, they didn't have a debate about whether or not this was something that should happen. The conversation from the beginning was about how do we actually get it done, which I think is a terrific statement of leadership on their behalf. So, questions on this for any of us?
So will current dentists be getting different continuing education courses, or is that something that's supposed to be looked at?
That's certainly the goal. I mean, do you want to speak? Here's an existing dentist who can speak specifically to that.
Yeah, I'm Ray Martin. I'm president-elect of the Massachusetts Dental Society, and I'm a wet-fingered dentist who currently practices in Mansfield, Massachusetts. And yes, the Massachusetts Dental Society is trying to work with the governor, the commissioner, and the secretary to craft programs from the dental deans that will have validity for dentistry. Because that's one of the biggest things when we start to look at these courses. They're not exactly the same between medicine and dentistry. So we want to craft courses and work with the Board of Registration in Dentistry to have guidelines where it's meaningful and that we actually have courses that will engage the dentist where they'll want to learn this. And so that's one of the things that we're looking at to stay in this with them, to accomplish that, and to be one of the forefront leaders in the country to do that.
So right now you're taking the same types of courses that physicians are taking?
Correct.
Is there any idea of how much is being diverted from dentistry versus a physician? You mentioned 80% was physicians and dentists, but I guess what's the responsibility of a physician versus what's the responsibility of the dentist? Any statistics on that? Any idea?
I don't think we have that detailed information, but dentists do account for a large number of prescriptions of opioids. If you look across the country, we're third or fourth in the number after family medicine, internal medicine. So they are being prescribed, but I can't answer that question.
I could add a little bit to that. I think David is right. Up to a couple of years ago, dentists were the third highest in terms of writers of opiates, usually short-acting opiates in general. That's actually seen a shift. We've seen a precipitous drop in writing by opiates, so we've had an impact so far, as well as emergency rooms. There's been a precipitous drop. What isn't necessarily happening with those patients' referrals and consultation and dentists getting used to referring somebody for substance use treatment is a whole new phenomena for the field. So we're looking at a drop, but also the follow-up in terms of access to care for folks to go through.
Governor, on a scale of 1 to 10, what's your level of frustration or waning patience with the legislature getting a bill through passed to address some of these broader issues?
I don't think about it that way. I know that they are trading proposals. I know that's an active conversation that's going on, and my hope is that they will be able to land in a place that works for both the House and the Senate sooner rather than later. I would be more concerned about this if there wasn't any back and forth going on with respect to the issue, but there is.